Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome back to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And that's why we're excited to focus on Mercy Community Healthcare. We're joined by their CEO, Cindy Siler, along with Dr. Jesse Malott, Chief Behavioral Health Officer with Mercy Community Healthcare. How are you two doing?
I'm great, Jeremy, and it's exciting to be here with you.
I'm happy to be here.
Well, we have a lot to dive into when you talk about how you all power the good with Mercy Community Healthcare. Let's start with some background and some history for the organization. So, Cindy, give us some background for Mercy Community Healthcare.
Okay, Jeremy, you may have to stop me or hush me up because I could talk about this a lot. Mercy's 26 years old this year. We started as Mercy Children's Clinic, and we're still known as Mercy Children's Clinic in a lot of circles. We spend a lot of time trying to educate folks on the difference in how we started and where we are now. We started honestly with a prayer. There was a few men that were really burdened by the lack of health care for children in the Franklin and Williamson County area. And we have, through the years, grown. We now provide primary care for adults and children. We provide mental health services that I think Dr. Malott talked about a little bit further. We also have a wonderful presence called Patient and Family Support, which actually works with our patients and our families with financial assistance, referrals to other services that they may need as a family or an individual. And we have just grown to look for partners in the community that we can serve and that we can serve their constituents as well as ours.
When you look at that evolution, especially going from children to now adults, families, children, the whole 9 yards, the primary health care, but also to the behavioral health and the mental side of this, touch on what that looks like for your team. Touch on some of the statistics when you look at the number of patients and individuals served. Give us an idea of what that growth looks like for you as an organization.
I'll start it, but I'm going to hand it off to Jesse. I will tell you first, I should have said one of the things that caused us to go from the children's clinic to adult services is the fact that our wonderful staff and our board of directors saw the need in grandmothers, aunts and uncles, parents bringing kids in that were not taking care of themselves. And it was a leap of faith to go into that area. And what happened is in 2013, we became what is called a federally qualified health center, which allows us to see people birth to grave and all of the services that we're talking about. And so that particular evolution put us in a position to be able to serve the underserved and the marginalized in our community and in, up to 30 counties surrounding Williamson County. So we have grown tremendously in that area and in that arena. Right now, we see around 14,500 patients a year. That is primary care and mental health. Since COVID, we have seen a huge increase in our mental health services. So I would just describe our primary care as a typical primary care for adults and children. And we do have women's health services, not OB, but anything else that's gynecology. And those are all typical, but what we do is Christ-centered and prayer-driven. So we see ourselves as a patient-centered medical home on that side of things. And again, that transition has happened and grown from the beginning. We provided behavioral health when it wasn't sexy or fun to provide behavioral health. And now we're seeing God's blessings and benefits from that, in that our mental health services have grown. So I'll hand it over to you now to describe that.
Yeah, I mean, we know during COVID we saw a major spike, around the country of suicide rates, depression, anxiety. So what happened is everyone kind of unified and started attacking the problem. And we have seen some improvement in the region as far as especially suicide rates and things. One of the places that Mercy has really thrown a lot of our efforts into is trying to create a sort of there's no wrong doer model, right? So we find that in the mental health system, sometimes there's just so many roadblocks for a patient to get services, to see someone. So they can access mental health services directly through counseling. They can get psychotherapy. They can do it through psychiatry directly there. But we also found that we know that most people receive mental health care with their primary care providers. And so we're like, hey, but they've got a lot of medical needs to attend to. So what we've done is actually insert trained mental health clinicians into the primary care environment so that they can actually tackle some of the issues, be targeted, and help bridge the gap between services. And so it's actually caused things to really grow. It also, one of the biggest things that's really helped with is the stigma that people still do associate with seeking psychotherapy services, psychiatry, because most people are willing to talk about stuff with their doctor. They have a hard time, connecting with the shrink, So what this does is allow them to kind of bypass some of that and get all their needs taken care of in a one-stop shop model. And it's worked really, really well for a lot of our people.
Yeah, I mean, it makes perfect sense because you've got the trust on one side, and they're also seeing these gaps and these challenges and yet opportunities too to serve at a deeper level. And so bringing that in a very holistic way makes perfect sense because then you really can step in and see real change and transformation. Talk about some of the things that you're seeing. And obviously, everybody's story is different, but when you look at the loneliness epidemic and like you said, kind of how that manifests in adults versus children. What are some of the challenges that you and your team are seeing from that mental health side right now that we're able to really kind of help step in and support? So what are those kind of challenges you're seeing right now that are some of the trends?
The two biggest areas that we are really struggling with are relational problems and sleep. And I think that most experts would say that it does seem to be very, very tied to the use of smartphones, social media, people just really being isolated because they're just using their devices so frequently. Adolescent insomnia I would want to classify it as a pandemic. It is enormous. And when you have insomnia, that little brain is developing during all those years. If you deprive it of sleep, it causes a whole host of problems, including things that stay with you through life. So that's actually one of the big ones that we're really tackling, as well as with the relational concerns. One thing that we've targeted is trying to bring on clinicians who have some experience with family therapy, couples counseling. We're providing additional training to shore up the services. We do a lot of work, a lot of times where even with severe mental illness, one of the best things that we can do is actually involve the families, and include them in that work. And so very frequently, even if they're meeting with psychiatry, we'll have a trained master's level counselor come in and join the meeting, and they do a lot of that work together. But we still have a lot of challenges to be able to address those issues.
You talked about how large of an area you all serve in terms of like the number of counties and the geographical piece of this. Talk about your team, how large of a team, when you look at kind of the reach and where you're able to meet people. And as you alluded to, all the training and the support services, not only for the community, but for your team to be able to help pour into them. Talk about your team in that aspect.
Yeah, so we have multiple divisions. One of our largest, more sprawled out division is our school-based therapy services. So we have 17 schools that we've got a licensed trained clinician in those schools embedded so they can provide psychotherapy to the kiddos. Those ones are really spread out between two counties here in Marshall and Williamson County. But we see patients throughout all of Middle Tennessee because we do a lot of telehealth. So people are able to have services either video, like what we're doing right now, or they can do a phone call. And one of the biggest reasons for that is because transportation barriers all over. We have seen like it is a large burden on mental health providers, in part because there's too few across our state. We are still in need of more trained mental health providers. And so one of the big things that we do to try to shore them up is provide regular meetings where we are actually doing focused training. We do attend to things like compassion fatigue, provide the spots, where we can debrief some of the issues. They do carry heavy stories with them.
I'm going to interrupt you.
Yeah.
The 17 counselors that are in Marshall County schools and in Franklin Special District are our staff, but they are really, is the word that Jesse used, embedded into those schools, makes a huge difference in how they serve those kids, the administration, and the parents. And then I would suggest, Jesse, for you to talk about the number of staff that you have, counselors and psychiatric nurse practitioners, and some of the modalities that you all do.
Yeah, so we've got we've got 17 schools represented with therapists. We are on-site counselors. We've got 16 folks who are in counseling services. We have 8 psychiatric nurse practitioners with a supervising psychiatrist throughout all of those. But one of the beauties that we've got is a lot of diversity in skill sets. So we've got some of our psychiatric providers who have good experience and training in geriatric and military service. In fact, a couple of them have served themselves in the military, which is a huge connection. We've got ones that are focused on the kiddos and just really do a fantastic job with the kids. For the counselors, certainly we have a lot of people who are well trained in kids and pediatrics because that's kind of where we came from. But they are very much trained in evidence-based treatments. We put a lot of emphasis on getting them trained in EMDR, internal family systems, CBT. We have even psychodynamic work available for people, couples counseling. We do groups. We just recently launched a group focused for men. Because men's mental health issues we're seeing a huge spike in concerns. So just really trying to constantly keep our ear to the ground of what does our community need from us, and trying to shore up those gaps.
Touch on, Cindy, as the CEO, the business side of this, because as you mentioned, when you look at the individuals, the families you serve, the cost of treatment, and this will kind of lead us over into the donations and fundraising and, that piece of it. But talk about the business side in terms of what it takes to operate the organization.
Oh gosh, that gets into the whole business model of a federally qualified health center. But what I guess the best way to describe it, Jeremy, is that we do see all patients, regardless of their insurance status. We will work with anybody with financial assistance. We have a sliding fee scale that we work with, cash base, however they want to deal with their insurance. So our focus and our ministry is obviously underinsured, which is what we term for Medicaid and in some cases Medicare, and then uninsured. There are so many people in our community, in the surrounding counties. We're right here in the depth of affluence. And the last feasibility study that we had done by Capital Link actually shared with us that there are 38,000 people in our 4-county area that are going without services, that have no access to care. So we look at all of those opportunities. We try to look at how to expand our hours. We now have pediatricians here on Saturdays from 8:30 to 2. We're constantly trying to look at the need of our community. And but yes, we, as far as the business end, we do generate revenue from the insurances that do come in, the commercial insurances and Medicaid and Medicare. But a good portion of our, a minimal portion of our funding comes from the federal government in regards to that grant. It's less than 10% of our full budget. People don't understand that. And I think one of the things that we did that we need to constantly correct when we moved and transitioned from Mercy Children's Clinic to Mercy Community Healthcare, I wish we had put banners all over all of Middle Tennessee that said, we have not lost our ministry. Our mission is still to see all patients regardless. And we still have scripture on our wall, and we pray with everybody that is seeking that or wants to be prayed for. We don't beat anybody over the head with the Bible ever, but we try to reflect Jesus's love and compassion in every service that we provide. And having that status as a federally qualified health center does not damage that. Our board of directors is committed to, if that is ever taken from us, they can have their money back, and we will continue to depend on the loving, caring people in these communities to donate and help us with sponsorships to provide these services to the marginalized and uninsured.
We'll carry that into how can the community support your efforts?
Okay, my goodness. I wish I had Beth Rattray here. She does it so well. One, we have 3 major fundraisers every year. We have a golf tournament in the spring. We are the sponsors of the Franklin Classic, the 10K, 5K, 1K run that happens on Labor Day in historic Franklin every year. And a lot of times people say, I run that race, but I knew nothing about Mercy being the sponsor of it, which I don't know if that's a good news or bad news, but it is very helpful to us. That's our largest fundraiser. And then on November 13th, we will have the Harvest Homecoming, which has become the name of our fall dinner. So it's more of an education type dinner. We have a speaker and good food and fellowship. And at the end of it, there's a band and dance and fun for young people, the old lady says. But it is more to just share with people what we do, who our services are for. I would be remiss if I didn't mention, Jeremy, that our churches in all of our communities, we are very much a presence in Lewisburg, which is Marshall County. We have a small health center there, and that's grown beyond its physical plant capacity. So we will be looking for sponsors and help down there to improve our building in the next couple of years. But all of the area, we are always looking for sponsors for those events. And then we're always looking for people who have in their hearts the desire to care for individuals and families who need access to health care, we're all a paycheck away from it, quite frankly. And our goal is to help somebody, body, mind, and spirit, to get back on their feet and to move into whatever needs. We connect with every partner we have in both of these communities to provide food and shelter and all the social determinants of health needs beyond what we can do as healthcare. We pride ourselves in having a good team that actually reaches out and does that well. But we need that's all services that you can't bill for. So we have a team of 13 in patient and family support that is just our ministry. That's just what we do. So that's always a place that if it's a touch point in someone's heart to give. We love to bring people in here for tours because we've been in our new building for 2 years. God has blessed us beyond any imagination with this building, and we want to use it to the best of our ability with great stewardship. And so we love bringing people in to share that. And once again, partnering with the community is one of the things that one of our values, we have 6 values, and one of our values is innovative community champions. We want to champion other folks in our community who serve our population and serve them well. Like Jesse and Stephen Neely are very involved in Find Hope Franklin, which is a community effort that our wonderful Mayor Moore put together years ago to help with the awareness of suicide. And as Jesse said, the stigma of mental health. We partner with the Refuge Center. We partner with lots of other services like GraceWorks and One Gen Away. So it's part of our makeup to do that and to bring sponsorship and donors into that reality to help them work with us and walk beside us in this journey.
Well, where do we go to learn more and get involved with Mercy Community Healthcare?
www.mercytn, as in Tennessee.org.
That makes it easy. So mercytn.org. Cindy, Jesse, thank you for all you and your amazing team do to power the good. Thank you for coming on the show.
Thank you for having
Jeremy.
us.
Yes, thank you.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.